Morning, everyone. Today is Thursday, July 20th. Thank you so much for joining in to our weekly healthcare reform webinars. Happy to have you join in every week, even in the midst of this hot summer weather. So I appreciate you taking the time. For those of you that are new to the format, my name is Deb Wilkinson, and I'm the Vice President of the Health Plan Options Department here at URL. My duties include overseeing the group health market and, as I say, what is left of the individual health market in the Commonwealth of Pennsylvania. We are in the midst of a lot of change with just from last week, and certainly want to bring you up to date. I'd love these webinars to be a place where you can come and get your questions answered and learn what is going on up to date. So just with a show of hands, you can ask questions by raising your hand icon on the control panel to the right of your screen, or you can type questions in the question box and I'll answer those at the end of the seminar. So without further ado, let's just get started. I see that you did raise your hand, so you can all see my screen. That's great. The new segment, the new administration, boy, what a change. Last week at this time, I mentioned that the details on the Better Care Reconciliation Act from the Senate would be released, and they indeed were released on Thursday afternoon. Those provisions were pretty dismal. I certainly won't go into a lot of the details, but quite frankly, I do think that the BCRA was really just nothing more than changing some of the names, advanced premium tax credit or cost share reduction to stabilization fund. So I think it's a lot of semantics, or it was a lot of semantics going on, throwing more money at bad policy. So I certainly wasn't a fan, me personally, a fan of the BCRA, but that seems to have resolved itself, because I think that is dead. Or is it? We don't know. It depends on the time of day that you listen to the news, whether the BCRA is going to move forward with, at least to a committee to, start talking about it, adding amendments, or there's also talk now of just a full repeal. So it's all going to be very interesting. Just last night, some of the details that came out was there are two steps forward, two alternatives: voting on something like the version of the Better Care Reconciliation Act, or voting on an amendment that would create a completely new version of the bill. The amendment, in nature of a substitute, would simply repeal the Affordable Care Act revenue and spending provisions and have a 2-year delay before changes would be in effect. So that's kind of what the direction that I think that they're going, probably just a repeal. And of course, there's a lot of folks now that did repeal, almost 60 times under a Democratic president to repeal the Affordable Care Act, that are now a little gun shy on repealing. So it's kind of comical. Mark Meadows, who is the chairman of the Freedom Caucus, and Jim Jordan, also a member of the Freedom Caucus, are kind of, they've created this website called Obamacare Repeal Traders. So they're kind of shaming these folks that the Republicans that previously voted for a repeal of the ACA into saying, hey, you did it once or 60 times, why not again? Mark Meadows also goes on to say that there's no reason we should put anything less on President Trump's desk than we put on Obama's. President Trump wants to sign repeal. It's time Congress send it to him. So, this is all the stuff going on. What will happen, I really don't know. Again, I think that it might be the repeal with replace in 2 years. But, let's have a moment of silence, and I can't even know for sure if we should have a moment of silence for the BCRA or the repeal and replace. So next week is going to be pivotal. They do say that they're going to bring some sort of vote next week. If, again, they've said that before. So if they think that they have enough votes for one of these options, then I think they're going to move forward with that. But you know, who knows? I thought something totally different last Thursday. I will certainly keep you up to date with whatever I find out. But at this point, it's a whole lot of craziness going on. I did keep this segment, the PCORI fees, in from last week because they are due on the 31st. So just a quick recap, PCORI fees are due on 7/31. They're filed on Form 720. PCORI is a patient-centered outcomes research institute, so it helps supposedly advance evidence-based medicine. Who has to pay the fee? Well, insurers of fully insured plans. So the insurance carriers, if your clients are in fully insured plans, the insurance carriers take care of these PCORI fees. Or if you are an employer with a self-funded health insurance plan or an HRA, then the employer is responsible for those fees. The fee is $2.17 for plans that ended 1/1/16 through September 30th, or $2.26 for plans that ended 10/1 through 12/31. The fees are based, for the health plans, they're based on covered lives. That includes spouses, dependents, et cetera, everyone that's covered under that plan. For the HRA, it is per family unit. So if you have 20 people, 20 employees on an HRA, then it's going to be 20 times the appropriate fee. It does not have to include dependents. So I thought that was worthy of just a reminder again, since it's coming up to that 11th hour. Again, if you do have groups that are in this segment, I would reach out to them and just do a friendly reminder. As consultants now, we are kind of obligated to do those sort of calls. And if you want more information on it to share with your clients, shoot me an email, debw@urlinsgroup.com, and I can send you some information from our HR 360 portal that could help you have that discussion or share that information with your clients. Speaking of training, tomorrow is the last day for those of you that may have been living under a rock and did not do 2017 FFM certification. That is going to be removed from the portal.cms.gov site tomorrow. This is, of course, in preparation for any 2018 testing and certification. It does appear, from what I'm seeing and reading, that they will, just like last year, have the option for a refresher course, and then for those that have not previously certified, the full shebang. So again, as soon as I get information on the 2018 training, I will pass that along. Capital Blue Cross forms, they have been updated. We're working to get those on our site. That should be done probably by the end of this week, or hopefully by the end of this day. But if you are writing a Cap Blue Cross group that you are going to be submitting today or tomorrow, reach out to your case manager, your new business specialist, and they can get you the appropriate forms. CE courses, Central Pennsylvania Association of Health Underwriters is holding their quarterly CE seminar here at URL. The registration is in this week's newsletter. It's August 16th, 8 to 11:30. They're going to have a segment very timely on ERISA and the requirements, the summary of plan documents, etc. And then also a self-funded 101. So again, these are all timely topics that I think that you would benefit from attending. So if you have an interest, you don't have to be a member of the Association of Health Underwriters. But again, it is August 16th, 8 to 11:30. Breakfast will be served. So if you have an interest in earning CEs and learning more about important information going into fourth quarter, I would encourage you to register. August 23rd, I'm holding a seminar also here at URL. It's going to have 2 CEs, and this is going to be sponsored by Prime Pay. They're going to talk about their top 10 items to review for healthcare reform compliance. Again, timely going into fourth quarter, all discussions that you will have to consider having with your group clients moving into fourth quarter. So again, more CEs that are being offered. And again, if you have interest in that, you can either go to our homepage and register, or again, it's in my newsletter. Medicare Connections or Leaders Conference. Our Medicare Connections conference is September 6th, and for those of you that have attended in years past, it's a great opportunity for those of you that aren't in the Medicare segment to hear from the carriers about what their products will look like for open enrollment for the Medicare Advantage programs. And then the next day, Leaders Conference, which is September 7th, is going to be for those that have any interest in learning more about annuities, life insurance market, health insurance. I'm going to have Geisinger, Highmark, and Capital Blue Cross there talking about their plans and not product really, but what their plans are, how they're planning for 2018. So again, you're going to get kind of a sneak peek into what 2018 may look like for your individuals and groups. But that is something that, I think all of you that have an interest in any of those topics, learning more, you may want to attend. Disability, employee benefits, all of the carriers will be represented there. Breakout sessions, so you can attend those sessions that are interesting to you. So again, register for that information is either on our website or it will be in my newsletter. I'm going to open it up for the open forum and any questions, but just as an FYI, I was approached by one of our agent partners in the Carlisle, Pennsylvania area, and they are expanding their Medicare operations. They have a Medicare sales position open, so if anyone out there is interested in learning more about that opportunity and what that may mean for your Medicare selling season, I would encourage you or shoot me an email and I can pass on the information about the agency that's looking for this position. Our next webinar, just of note, is not going to be next week. I am going to be on vacation. I still will produce a newsletter so that if any vote takes place, I'm passing that information on, but I will not have a webinar next Thursday. It will be the following Thursday, which is August 3rd. So let's see how many questions we have today. And I have none again. My goodness, everybody is either hot, tired, or there's just nothing to ask because there's no direction that we know we're going in, right? So as always, I truly appreciate everyone joining in. If you have questions about anything we discussed, please reach out to me. You can reach me here via email, debw@urlinsgroup.com, or you can give me a call at 800-926-8875, extension 113. Thanks so much for joining in, and I hope you have a great balance of the week. I wish you all a wonderful week next week. I won't be here, as mentioned, but I will join back up with you on August 3rd. Enjoy your weekend. Bye-bye.